who is the chairperson for Rudasa. Dr. Mbangata, thank you for joining us. How are you this morning?
I'm very well, thank you, and so much. Thank you so much for having me.
Our pleasure. The Rural Health Conference, it has been in existence for many years. What have you gained as Rudasa that you have implemented in the communities that you serve?
Okay, so number one, yes, next year we will be celebrating 30 years as RHC, the Rural Health Conference, since it was in inception in 1996. So this is a great step and milestone for us. It has been a great journey, really, where Rudasa has over the years collaborated with nurses, with the Rural Rehab South Africa, with the clinical associates, which is under the banner Pakasa, and we have also, collaborated with Runesa, Rurisa. It has all come together to, collaborate all healthcare workers from across South Africa to ensure that we have the support and do not feel like we are practicing in isolation, because rural practice can become quite isolating, for healthcare professionals, where you find that you don't have the necessary skills and the support and people to actually understand the challenges that you are going through. So this is quite a milestone for us. And over the years, we have noted that the lack of support and skills that was identified amongst the professionals, especially the young ones who are fresh out of community service or fresh out of internship coming into rural practice, there has been a need to, upskill and kind of support them. And as a result, we have collaborated with various doctors from various professions and various disciplines to ensure that we have a mentoring program that we run every year for about 8 weeks. And this is done under the leadership of Dr. Mola, who is based in East London. So that is just one of the steps that we have taken to kind of meet the gaps that have come with the challenge of working in rural settings. And of course, we also acknowledge HCPs who are working in rural health, because this is quite a dedicated service. For example, we have Rural Doctor of the Year, where, votes come in and we acknowledge and hail and really, celebrate the doctors who have done wonderful contributions working in rural settings and doing amazing work, dedicated to a service that most doctors and, other healthcare professionals really can't deal with and run away from.
Sometime this year, the country's health minister, Dr. Aaron Motsoaledi, announced the employment of doctors. Has it made any difference when it comes to the rural areas specifically?
To be honest, the challenge of unemployment is quite a big one and cannot be solved overnight. We do understand that rural communities have always had this ongoing issue of, unemployment, skills that are quite lacking, also as a result of doctors not being retained. Not that they aren't getting employed, they do get employed, but as soon as something better comes up, you will find that doctors will migrate to where they feel they will have more professional development. So it is going to be a challenge to really meet that gap, because currently the unemployment crisis is something that is being faced all around the country, and it will strike the rural population quite more, and we are seeing that at great scale when we're looking at the resource shortages that doctors face in those facilities. It doesn't act as an attractant, and as a result, the rural doctors or rural communities will always have the last pick of doctors, because doctors always try to find employment where there will be better opportunities, or where they perceive that there will be more professional development and a better environment to raise families, etc. And so that is still a huge challenge for us. And if you also look at the fact that 30% of doctors in South Africa are concentrated in the public sector, and you have 70% curtailing to, just the private sector. So that on its own tells you that we still have a huge problem and crisis, and we do need to, advocate for rural doctors and rural communities to have better access to care and good quality health services.
How do we make then the rural areas more attractive for doctors to want to work in them? And I don't know if it would be a matter of making the actual rural area more attractive, or just finding those doctors who really do want to serve those communities. But how do we make it more conducive for doctors to want to be there?
You find that when you are looking at doctors who are working in rural areas and why they are based there, it's because of the exposure they had in their undergrad, the exposure they had in their community service. And that is where we are currently focused on. We're trying to really catch them while they are still in varsity, trying to inspire them to stay in rural, because once they leave, then it becomes quite an issue. And of course, we also need to look at government policies that will help, strengthen and attract doctors to stay in those areas. But of course, you can't stay in an area that will be underdeveloped. So it means infrastructure needs to be looked at, support services need to be looked at. We also need to, prioritize rural proofing, ensuring that whatever policies government implements, it also looks at how feasible those are for rural communities in order for doctors to stay, in order for nurses and rural rehab, professionals to stay in those areas. And that is still a challenge and an ongoing debate that we need to continue to advocate for. And I'm really glad that you are covering this story today, because somebody else may not be aware that rural health conference even exists, or that rural doctors associations and rural nurses associations exist. So these kinds of conversations can start, that implementation and advocacy going, and it will really do good for the rural communities.
Dr. Mbangata, we thank you again for your time. We appreciate your insights.
Thank you so much. Thank you.
Dr. Asafika Mbangata is Rudasa's chairperson, that is chairperson for the Rural Doctors Association of South Africa, talking about a conference, an annual rural health conference, which began this morning in the KZN, Kwa-Zulu Natal province of the country.